Welcome everybody. Today I am starting the remaining part of the yesterday's lesson, and today I will be dealing with the drug elimination. Elimination is a process of irreversible loss of drug from the site of measurement. There are two processes by which it occurs: excision and metabolism. The excision is the irreversible loss of an unchanged drug. Metabolism, the conversion of one chemical species to another. Some drugs require metabolism as the metabolites are the active drug form. For example, codeine is metabolized to produce morphine. Occasionally, metabolites are converted back to drug, that is, metabolic interconversion. Binding of drugs to plasma proteins. Total drug concentration can be measured in either blood or plasma, and therapeutic doses adjusted accordingly. Total drug concentration exists in two forms: that which is bound to plasma proteins and the other plasma constituents, and that which is free or unbound. One is bound and one is unbound. Bound to proteins, plasma proteins, and other plasma constituents. In blood, many drugs irreversible bind plasma proteins. The drug of protein binding, that is the degree of protein binding has important pharmacokinetic and pharmacodynamic implications. Because it is the unbound moiety, concentrate on this is very important, unbound moiety that readily diffuses across the biological membranes and reaches the receptor site. The degree of plasma binding is often expressed as percentage of the drug bound. Another term of frequently used is the free fraction of the drug in the plasma or serum. This is equal to the free drug concentration divided by the total drug concentration. Now, factors affecting protein binding. The plasma binding of many drugs may decrease or increase due to a variety of pathophysiologic factors. For example, liver disease, burns, malabsorption syndrome. Because of these, measurement of total drug concentrations alone may be misleading and cause an inappropriate increase in the therapy, which might be potentially hazardous, or to the initiation of subtherapeutic doses. Pharmacokinetic and pharmacodynamic principles. Pharmacokinetics is a quantitative study of the absorption, distribution, metabolism, and elimination of drugs. Basic pharmacokinetic principles. C max, that is the concentration maximum. Clinical relevance together with T max, the time max, C max is a surrogate marker for the rate of absorption. Increased rate of absorption may increase the toxicity. Decreased rate of absorption may lead to delayed onset of drug effect. Now, what is steady state? Steady state, concentration of a drug or chemical in a body fluid, usually plasma, at the time of steady state has been achieved, and the rates of drug administration and drug elimination are equal. The effects of a drug, pharmacodynamic, toxicodynamic, can only safely be evaluated after drug concentration each reach the steady state, usually after 5 terminal half-lives. Now, what is bioavailability? The percentage of dose entering the systemic circulation after the administration of a given dosage of drug is the bioavailability. Oral bioavailability usually is less than 100%. Incomplete absorption from the gut or significant first-pass metabolism in the liver decrease the drug levels in the blood and hence the bioavailability. In many cases, the pharmacogenomics or the genetics of the enzymes and transporters involved affect the oral bioavailability. Many drugs with low oral bioavailability, such as immunosuppressants, will require therapeutic drug monitoring. Under normal circumstances, bioavailability after IV administration is always 100%. Now, what do you mean by AUC? AUC is area under the curve. Area under the plasma concentration versus time curve. The parameter that is correlated with most drug effects is systemic exposure. AUC is a surrogate marker of exposure. For many drugs, AUC can be correlated with pharmacodynamic and toxicodynamic effects and can be used to establish bioequivalence of different drug products with the same active compound. Thank you. This is for today lecture. Next day I will come with a very interesting topic.